Hello, this is Elizabeth Makous, the Pelvic Whisperer. I am here today by request to make some clarifications about the use of the U-wand, which we now more appropriately call the trigger wand. So let's get started. First, I would like to show you how the face of a clock can be used to represent your pelvic floor. The clock is so helpful because it's a great communication tool for the therapist to talk with the patient. And we use these numbers, the 12 o'clock, 3 o'clock, 6 o'clock, so that we can communicate with each other as if the therapist is looking at your pelvis the way you're looking at mine right now. Let's start with the male pelvis because most likely the male pelvis will be the one that'll be using the trigger wand. But I have to tell you a funny story about my penis model. So I saw this one day and I just had to have it because I thought, oh, this nice limp penis will be perfect for the video, a medical video for obvious reasons. There's lots of hard models out there, but I didn't want to use it. And then of course my 20-year-old son saw the first video and called me and said, Mom, I just gotta say, that penis is just creepy. So anyway, I decided to use it anyway. It made me very sad, but I like it, so if it gives you the creeps, I'm sorry. That is not my intention. It just seems to work. So here is the penis, right over where the vagina would be in this model. And what I want to show you is basically how the U-wand, what it would be doing and what muscles that you're going to be trying to release. So the U-wand is going to enter the anus. It has to go through the external and then internal sphincter, and then it's going to hit, in pelvic pain patients, this puborectalis muscle. And that muscle generally helps support the rectum, which is wonderful, but when it's in spasm, it really blocks your ability to have bowel movements, and it's usually very painful. So that you're going to have to get through those resistances first and release those muscles and relax the anus, because the anus is still going to want to just reject anything entering into it. So when you go up towards the 12 o'clock position on the clock, that is going to be towards your prostate and urethra. And the urethra is fairly well protected in a male because the urethra has to go through the prostate and through the penis. So feel free to release the prostate and all the trigger points around that region. Now, in a female, our urethras are obviously much shorter and they're not as well protected by the fascia and the connective tissue of the vagina. So especially when entering the vagina, I always have my patients stay off the urethra unless there's some specific, treatment I'm trying to devise for that patient. But even when entering the rectum, when the U-wand goes in, you are much more protected because you have the posterior vaginal wall. But still, generally, unless your pelvic floor therapist tells you to, I would stay off the urethra, the 12 o'clock position when you're a female. Then we can go on to the 1 and 2 o'clock positions and the 10 and 11 o'clock positions. In these positions, when the U-wand is going in, you're going to be angling the U-wand towards those positions. You're basically on the iliococcygeus and the pubococcygeus muscles in that region. And then if you get deep to that, you're going to be hitting the internal obturator muscle. Now, when these muscles are tight and in spasm and they're tight enough to compress on nerves, where you're going to feel it is right in your inner thigh. It's going to refer pressure and pain down here. So you know definitely these muscles need to be released. So hang out on those muscles and let them relax. Then, as you angle the wand more towards the 8 and 9 o'clock positions, or the 3 and 4 o'clock positions here, you may end up hitting harder structures, bony-like structures, which would be the ischial spine, and there's some tight ligaments in there. So you want to not hang out on those too long because they won't release. But certainly the muscles around that, you can drop into the pelvic floor muscles around that and release that region. Now, then you will need to, which we'll go over more closely in detail, of course, switch the wand around to get the 5 and 6 and 7 o'clock positions. So the wand, the straighter end of the wand is going to be going in to release that. Those muscles are more the coccygeus muscle. You'll be near the coccyx, and deep to all the coccygeus muscles is the piriformis muscle. And when you're around the piriformis muscle, you may get a lot of referred pain into the glutes, the lateral hip, down the back of the legs. All of that means that muscle's tight, it's trapping nerves, and you need to release it. In general, when the pelvic floor has been in pain a long time, absolutely you can expect anywhere you're releasing in the pelvic floor may give you cramping and refer pain up in your abdomen. I've had people go to the tip of their toes, to the top of their head, so that can be normal. It just knows that, yeah, those muscles are tight and we need to release them. In a minute, I'm going to show you how to use the trigger wand on 2 different models. But some helpful hints to help you get set up. Have your lube nearby, maybe some tissues and some wet ones, and an extra towel, and then lay a towel down on your bed, because as you know, it may get a little bit messy. Alright guys, here is your pelvic floor with you lying on your back when you're getting ready to treat with your trigger wand. So the knob end of the trigger wand, I just wanted you to see something. Here's your rectum, here's your bladder, your prostate, and then the urethra running through the prostate and out the penis. So when the knob end of the trigger wand enters your anus, into your rectum, you can see right there where you're going to hit your prostate. Just know that in normal males with no pelvic pain, this can sometimes actually feel good. But with men with pelvic pain, it generally doesn't feel good at all. So the goal with releasing this region is eventually to get some pleasure feelings back there. Alright, I've switched to the female model just for better demonstration of how to use the trigger wand. So here to orient you, we have the bladder and the urethra, and then the uterus and the vagina, which you can see there's some protection for the urethra. But then when you go into the anus, you have more protection towards the urethra. When you use the trigger wand, again, we are going to start with the knob down and towards you. We're going to massage and lubricate your anal sphincter so that we can relax it so it won't spit your wand out right away. We want to just relax everything, desensitize it, lubricate the knob, and slip it gently into the anus for your treatment. Here you'll be able to treat from the 9 o'clock to 3 o'clock positions on the pelvic floor. And then you will slowly withdraw the wand, carefully and slowly as not to re-spasm that anal sphincter. Then you're going to get your wet ones, clean it off, and turn it around. Now, so we've cleaned it off, we've lubricated the pointy end of your wand now. Here we have to turn the knob, it's up and away from you. That way we can easily slip the knob into the anus. Then you're going to grab here and lightly turn it around so that you can grab the knob gently and pull towards you so that you can gently release the 3 to 9 o'clock positions on your pelvic clock. And then again, pull it out slowly. When releasing the angle of the wand, I designed it so it naturally limits how far and deep you go. If you can imagine, you only really need to go as deep as your longest finger, because your therapist is also only treating you as deep as their longest finger. So just imagine this, put your finger, and then you'll kind of know how far you need to go and how it will limit you. For all you numbers guys out there, feel free to set a timer for 90 seconds. But eventually, I really want you to pay attention to what's going on in your pelvic floor. Feel what it feels like for it to release, because in the long run, you want to be out in public anywhere you are and be able to feel, get in touch with your pelvic floor. Now, I know that's going to be really hard for some of you guys and gals, and you think you'll never be able to do it, but I believe in you. I know you can do it. Just focus. Get in there, feel your pelvic floor so that you know when it relaxes. I hope this has been helpful to clarify how to use the trigger wand safely to release your pelvic floor. But I cannot reiterate enough how important it is to get a thorough medical exam, get a good pelvic floor physical therapist, and learn how to release your muscles safely. So be blessed and happy releasing.